Absolutely. So the big problem that we're trying to address is subdural hematomas. It's not a sexy topic, but it's a very prevalent one. It is something that is increasing in prevalence as the population ages. Old folks tend to have their brains atrophy a little bit, and as the brain shrinks away from the inner side of the skull, that puts on stretch the veins that go between the dura and the brain, and those can tear with any little jostling or fall, as old folks are prone to have. That resulting hemorrhage can be quite difficult to manage, not from a technical standpoint, but because it likes to come back over and over and over again. And of course, anytime you're subjecting particularly older individuals to surgery, there are risks. They have comorbidities, they're on blood thinners, and so it's a real problem. So as it turns out, there was a small Japanese trial many years ago that showed that if you embolize the artery that fed into this area, that fed the membranes that keep this problem alive, you could reduce the rates of recurrence. And so we wanted to put that to the test and do a randomized trial to assess whether or not embolizing that middle meningeal artery would actually reduce the rates of recurrence, improve clinical outcomes, and hopefully spare a few people some surgery. So that's the basis of the trial. Okay. Now, we did the embolized trial is one of about 6 current trials that are nearing completion or have completed, looking at this same problem. And the way we designed ours was to separate the patients out between those who fundamentally need surgery. They're a little bit more significantly impacted neurologically. They have larger hematomas. They need surgery. Versus those that don't necessarily need surgery right up front. Their symptoms are more minor, the hematomas are smaller, and we have those as 2 separate cohorts. What we're reporting today is the surgical cohort, which we have completed enrolling 400 patients randomized to either receive surgery plus MMA embolization or without MMA embolization. It's an exciting time because this is coming out at the same time as these other trials. Now, at ISC, we presented the initial results alongside the STEM trial and alongside the MAGIC-MT trial. Both MAGIC-MT and Embolize, our trial, used Onyx, the Medtronic liquid embolic device, and then STEM used the BALT device. But all 3 of the trials showed dramatically positive results. So what we found is that for our primary endpoint, which was the hematoma coming back and requiring an additional trip to the operating room, that we had a 3-fold reduction in the number of patients who were spared that additional surgery in the test arm, in the embolization arm. Similarly, the STEM trial showed a reduction. And interestingly, they had their largest effect actually in patients who didn't need surgery in the first place. They had sort of lumped the 2 together, but they had a very dramatic effect in that population. MAGIC-MT, similarly, a dramatic improvement and reduced rates of their primary outcome. So very exciting time because we think that we're on the cusp of a paradigm shift. Really, the goal here is to reduce the number of shall we say, maximally invasive procedures that we're doing and to help the population, and that's absolutely the direction that this is all pointing.